In Chinese medicine, two of our diagnostic tools are the tongue and the pulse. Now, when I look at a patient's tongue, I'm looking at several features. I'm looking at the shape of the tongue, whether there are tooth marks or not on the tongue, the color of the tongue, the coating on the tongue, the color of the coating on the tongue, several different things. And what does that tell me? Well, it tells me the state of the inside of the body. It points mostly to the stomach and the digestive system, but it can also tell me quite a bit about other aspects of the body. So if we look at her tongue, and I just want you to lay it out there. Okay, we can see that it's pale. It has tooth marks on the side, and it has a very slight quiver, but the coating is actually pretty good. A little bit of yellowness to the coating. You can relax, thank you. Now, after looking at her tongue, what that tells me is she has, in Chinese medical terms, what we would call a qi deficiency with a little bit of associated heat. Now, I don't know exactly where that heat is coming from. I can guess it's probably coming from the stomach or the guts somewhere, but I'm not sure. So to really nail down some things, I'm going to take her pulse. I'm going to take her pulse on each wrist. Now, in Chinese medicine, when I take the pulse, I'm taking it in each wrist in 3 spots on the wrist. On each spot, I have 2 depths, a shallow and a deep depth. So I'm feeling a total of 3, 6, 12 pulses. So there's a lot of information. Now, in Western medicine, when we take the pulse, the only thing we're concerned about is how fast it's going and if it's regular. In Chinese medicine, the pulse tells us so much more than that. So, for example, I will just take her pulse on her left side. Now, each of these 3 positions corresponds to an organ, and the same on the right. So by feeling her pulse, what I'm feeling for is the quality of the pulse. And there is something like well over 20 descriptors of the pulse. Things like slippery, wiry, tight, short, long. Many different qualities of the pulse. So by taking her pulse on each wrist, that can tell me about her organs or the state of her health. And that's what you can determine from the pulse. Now, a little bit of trivia. You can tell if a woman is pregnant by the pulse. You can tell the sex of the baby by the pulse. And I've done both of those things successfully myself, so I know that it can be done. The 3 places on each wrist are right next to each other. There's 1, 2, 3 places. Each place corresponds to a different organ. For each one, there's a depth, shallow and deep, depending on how I press. Each one I'm feeling a shallow and a deep pulse. So that's 3, 6 per wrist for a total of 12 pulses that I'm feeling. Still, another treatment modality in Chinese medicine is Chinese medical bodywork, or Tui Na. Tui Na is a wonderful tool for patients who complain of anything from musculoskeletal complaints such as back pain or neck pain or victims of car accidents. It can be used in things like fevers. It's the treatment of choice in children. Tuina, there are many different styles of Tuina. The Tuina that I personally practice is something called dynamic Tuina. And it's a wonderful set of techniques for for relieving pain and for helping the body realign itself and to heal. So, some examples of Tuina, for example, someone complaining of shoulder pain might be to help release the shoulder. Someone complaining of low back pain, I might release the hips. So, for more information on Tuina, check out my video on the subject or massagenerd.com. Also, you can get information about me through my website, qidoc.com. That's QIDOC.com. In Chinese medicine, our pharmacology is herbs. Chinese herbology is a subspecialty of the medicine. You don't need herbs to practice the medicine, but they can get things done quickly or more dramatically. Chinese herbology is very different from the European tradition of herbs. In Chinese herbal medicine, an herbal formula can contain anywhere from 2 to 14 or 15 different herbs. And each formula typically is individualized for a given patient. The way that Chinese medicine looks at herbs is that anything that you can put into your body, food, herbs, anything, has a specific effect on the body, and everything that you ingest has certain qualities, such as coldness or heat or bitter or sour, different flavors. For example, certain herbs such as ginger is very warming. Ginger is what we call pungent, so it moves things and it tends to calm the stomach. Other herbs such as ginseng, or in Chinese renshen, is a very important herb. Ginseng is not the kind of herb that we would give indiscriminately to people. Unfortunately, in this country, ginseng has been touted as a cure-all for almost any condition, and it's not. It truly isn't. Ginseng, there are actually several different kinds of ginseng, and depending on your complaint, that would dictate the kind of ginseng you would be on, what herbs we would pair it with, and how long you would be taking it. To take ginseng indiscriminately is equivalent to taking penicillin indiscriminately just because you think you need it to ward off colds.
So would the body get immune to the ginseng like it can get immune to penicillin?
Well, that's a good question. If it could build up a tolerance to ginseng. The other thing is, if you don't need ginseng and you're taking it, it's not going to do any good. It's the same thing as if you don't have a cold and you take penicillin just because you think you should take it to keep away a cold. Doesn't do any good.
But doesn't do any harm either, though, right?
Well, that depends. See, just because a product is natural doesn't mean that it's safe. And herbs can interact with medicines. Ginseng can have a profound effect on a person taking Coumadin, which is a blood thinner. Ginseng can prolong bleeding time. So if you're on Coumadin and you're taking ginseng, that's not a good combination. And there are many, many interactions between medications and herbs. And that's why it's so important to see a doctor of Chinese medicine before you start taking any herbs.
Thank you for that advice on herbal medicine.
You're welcome. So today you have seen many different faces of Chinese medicine. As you've seen, there are many aspects to this complicated medical model. Acupuncture is just one tool, but I've shown you many of the other tools, including cupping, gua sha or scraping, tui na. We've talked about herbal therapies. And there are even more tools that we have yet to talk about, such as dietary therapy. Chinese medicine is a wonderful medical model. Chinese medicine is good for many, many conditions, such as painful conditions, chronic conditions, conditions such as fibromyalgia or diabetes. Chinese medicine can be used in many, many cases. Many times when Western medicine doesn't quite seem to have the answer. In addition, Chinese medicine is also very effective in cases for smoking cessation, or one of the hot new areas is cosmetic acupuncture. For example, acupuncture facelifts, which is very exciting and has wonderful results. So if you're curious, ask a doctor of Chinese medicine, and remember, you want to ask for someone who is either a doctor of Oriental medicine, an acupuncture physician, or a licensed acupuncturist who is board certified through the NCCAOM, which is the board that certifies doctors of Chinese medicine in this country. For more information, you can either contact myself, Steve Collins, directly through my website, www.qidoc.com. That's QIDOC.com. Or you can email me at qidoc@qidoc.com. Or you can contact massagenerd.com, N-E-R-D. And be sure to check out all the other videos and DVDs in this collection. There are many more that can be potentially helpful to you and give you a wealth of information. Thank you so much for watching me today. I hope that it's been educational and enjoyable for you. I hope to see you again.